I'm April Kapu. I'm the president of the American Association of Nurse Practitioners. Today, we are in Hawaii on the island of Oahu at Dole Middle School, where they have a program called the Hawaii Keiki Program. It's a partnership with the Department of Education to bring in nurse practitioners and RNs to provide a school-based clinic. We're going to head inside and meet with the Hawaii Keiki team.
And really what it's about is providing equitable care
Right.
across all of our schools and across all of our islands. So having a nurse here in these clinics really allows for that connect or reconnection to a service provider.
So I work at a very low income, it's a Title I. Prior to this, when like a student came in with like an ear infection, I look in the ear, right? It looks, tympanic membrane looks red, looks bulging, but all I can do is tell the parents, oh, go take them to the PCP. But now I can connect them with our nurse practitioner. So how that works is we have this little device here and there's these little applications. So the nurse practitioner can be wherever on their end. They'll direct me if they want to listen to heart, lungs, look in the ears, or they can just see the student from the iPad and like ask them questions and stuff.
The technology has just totally expanded what you've been able to do. Yeah. So here we have a nurse at a satellite clinic, and she's transmitting all of this to the nurse practitioner at the hub.
A lot of the students that we serve have social and economic disparities, so it makes our populations pretty challenging, but our nurses always step up in and day out to show up for these kiddos.
Yeah, the state has really been very challenged with having enough mental health providers. I think we see that nationwide, right? So this is an opportunity to be able to at least give them some of that acute care and then try to connect them after a few visits to a community provider that's able to see them. And you don't want to say to a student, we can get you an appointment, but in 3 months.
Right.
3 months, no. They're having a crisis now that may actually be situational. You know, their boyfriend broke up with them or whatever that is. And it may only need a few appointments with our psych mental health nurse practitioner. Really, we need to build that pool within our state and be able to spread that throughout all of our neighbor islands. We really want to make sure that equity is really at the top level for us to be thinking about.
The work that the school nurse practitioner and the school RNs did to provide a safe space for the students who may not have had the opportunity to communicate about some of the more sensitive subjects at home or with their elders or with their other relatives, but knew that they could come to the health room, they could sit down with Nurse Bobby Joe and tell her all of their woes and all of the things that they were going through, and that they wouldn't be judged, and that they were safe, and that there was support and there were resources, and just watch them grow and flourish. It was a really great experience. Like I can't even put it into words how much it touched me and how much I wished it was around when I was in school. And like I can't wait to see what it does with the rest of the state and nationally.